We're all human, yeah? So everybody's vulnerable. Everybody is susceptible to mental health issues. My name is Kimberly Chew, and I'm a psychologist and also the clinic manager at Annabelle Psychology. There are actually a lot of things to look out for, but I think that I'm just going to name a few, but I think that if, say, for example, you have a person in your family who you suspect, who has, of course, experienced a traumatic event, and you suspect that that person is suffering from PTSD, perhaps some of these might be helpful in terms of encouraging that person to go forward and speak to a mental health professional. However, of course, when it comes to diagnosing and evaluating the condition itself, you would probably be best talking to a mental health professional who'll be able to assess your current situation. But I think some red flags to look out for, and it's quite like an extensive list as well, but just to keep in mind would be things like unwanted or upsetting, intrusive kind of like memories. The person would also be experiencing flashbacks. So this is a very big one as well. So like what I mentioned earlier, kind of like reliving the traumatic event all over again. Not being able to sleep well and really experiencing nightmares. So kind of nightmares that are related to the traumatic incident. High levels of emotional distress, so not being able to function well or being able to cope emotionally. Physical reactivity as well, so like some of the physical symptoms that we talked about, like, whether it's increased heart rate, difficulties with breathing, or things like that, would indicate that this person is very much in that fight or flight kind of mode. Some people might also, after experiencing a traumatic event, be unable to recall key features of the trauma. So, this person might be dissociating, and this could be also an indication of PTSD. Another thing would be kind of like overly negative thoughts or assumptions about yourself or the world, or kind of like the safety of your surroundings, difficulties feeling positive feelings, so kind of really feeling very distressed and a lot of low mood most of the time. And some other things to kind of like look out for would be a decreased interest in regular activities that would cause kind of like pleasure, and the person starting to isolate themselves or pull away, or kind of to just not involve themselves in social interactions, or show a disinterest in being with people. So kind of just isolating themselves and cutting themselves off from everyone else in the world. So I think that these are some important things to take note of, definitely.
Can you just give a little bit more insights on how like a psychologist may speak to a patient to evaluate and diagnose the PTSD?
So PTSD can be diagnosed by a trained mental health professional, such as a psychiatrist or a psychologist. So for a person to be diagnosed with PTSD, their symptoms, so a lot of the symptoms that we talked about just now, must last for more than a month and must cause significant distress or problems in the individual's day-to-day functioning. So many individuals develop symptoms within three months of maybe experiencing a traumatic incident, but some symptoms might appear even later than that and persist for sometimes like months or even years for some people. Another thing to kind of like keep in mind is that PTSD occurs with a lot of other conditions as well, such as things like maybe perhaps depression, sometimes there's substance abuse, memory problems, and other kind of like physical issues. So therefore, it is important to kind of speak to a mental health professional so that person can understand you, understand your background, and provide an accurate evaluation and diagnosis.
Very important to speak to the professional to get all this. And I think it's very important to also know that sometimes many mental health issues are not a standalone issues. They come together with many other things like depression, anxiety, as you have rightly pointed out as well, right?
Absolutely.
Can PTSD be treated completely? Can it go away and not come back forever?
What we do know is that there's no definitive cure for PTSD. However, what we know based on research, a lot of research that has been done on PTSD, is that treatments such as psychotherapy, so when we think about things like cognitive behavioral therapy, can help to alleviate the symptoms, reduce distress. So really that's a big objective. So such that the person is able to manage their difficulties and move forward and continue to lead a meaningful life when they're not pulled or held back by symptoms of PTSD.
So what are some of the words that you would like to say to people who are suffering from PTSD?
What I'd like to say to somebody who's suffering from PTSD is that it's okay to feel the way that you feel, given what you've been through. So given your traumatic background, what has happened to you is not your fault. So you do not need to navigate also these difficult times on your own. Please reach out to a mental health professional and allow that person to talk you through how they can help you and address any of your concerns.
How do you sort of relieve yourself of all the issues and the troubles that after you hear from the patients in your clinic for the whole day? Do you yourself feel like trouble and like a lot of negative feelings in yourself when after you listen to all your patients?
This is something that is very important for a lot of psychologists, because individuals who are working with complex cases, that can lead to post-traumatic stress for themselves as well. A lot of the time also because the line of work that we're in is highly stressful. So this can lead to burnout as well. So therefore, it is very important. And I think that, as far as my fellow psychologists are concerned here, I'm probably preaching to the choir, but it is so important to prioritize things like self-care and self-compassion. So when we think about self-care, really that's just taking that time to look after ourselves, to make sure that we're sleeping well, to make sure that we're eating well, to make sure that we're taking time for physical activity, spending time with our loved ones, or maybe connecting with nature or whatever it is. But really to just have that protected time is going to reduce our vulnerability to stress, which ultimately prevents mental health issues from occurring for ourselves. Because as therapists as well, we're all human, so everybody's vulnerable, everybody is susceptible to mental health issues. I don't think that excludes any of us. So for us to be able to safeguard ourselves and to ensure that that we can do our best or be in the best position to be able to help people and work with the clients and do the work that we do, it is so important to carve out that protected time for ourselves and to make sure that we ourselves are doing okay and that we have the time to rest and recharge. And of course, there are also our peers. So people working in an organization, other psychologists are people that we can sometimes talk to about how we're feeling, and also to kind of, share tips on how we can take care of ourselves, and our own mental health. So it's nice to, of course, have that kind of support from peers and other professionals, but also prioritizing that time for ourselves. I feel that this is so very important for a lot of people who are currently out there, doing what they do, working with people on a daily basis.
I think it's very important to be able to help yourself to help everyone else, right?
Yes, it's good. It's good that we need to remember and acknowledge that. It's so important.
Don't forget to like, comment, and subscribe for your regular dose of Asian health information.